go.
Perfect.
So welcome. This is session 1 of Stress in the Healthcare Workplace. We are glad that you are here. We are excited about sharing this information and starting the conversations of some great discussions. I am your host, Audrey Johnson. I am a pharmacist and senior consultant professional trainer with RxView, LLC. And the co-host on this show is, on this segment for session 1, is Mr. Travis Diamond. And you can introduce yourself, Mr. Travis.
Absolutely. First of all, I want to say thank you for, inviting me to be a part of this. I'm super excited, not only to share what I've learned about stress, but to learn what others, from others' perspectives, and to learn what you have to share. So as you mentioned, my name is Travis Diamond. First and foremost, I am a husband and a father. I am the co-founder of the Adventure Group, a lifestyle organization, the host of the Talks with Trav podcast, and I am a personal and professional strategist, specifically around stress reduction and work-life harmony.
Awesome. We're going to stop sharing the screen and move forward with the segment. So I'm excited to move forward with this conversation. Healthcare is really feeling a lot of stressors, and even more so than we previously had before. So stress in the work in the healthcare space, with healthcare being such a regulated profession, there is so much. Hey, welcome to the segment. There is so much to be concerned about, worried about, over and above your normal duties as a healthcare professional. And we deal with, in healthcare, as I'm a pharmacist by profession, and I've been in administrative roles most of my career. So just to kind of give an overview of what that looks like for me, workplace stress actually is absolutely in all industries. It absolutely is. However, for the discussion of this topic, healthcare practice settings is our primary focus. There has statistically been a dramatic increase in workplace stress. And this is validated by a number of various entities that measure statistics. And I don't want to hang on to the statistics. However, I know that one of the readings that I did walk through discussed the increase in heart attacks and workplace violence. We see that on a regular as well. And that has been most concerning, especially with the increase in violence that we've seen, people being dismissed, the work dynamic changing, business units closing, staff reduction, labor reduction. The economy has changed. There's so much quitting in the workplace, and there's just a heightened emotional distress that's really present in the workplace. So our goal was to talk on some of these factors and kind of walk through some of the talking points to work with the healthcare professionals and give them some identifiers, because as a pharmacist, I have extensive experience in a variety of practice settings, from retail to hospital, nursing home, specialty infusion. I do consulting to business units. So I've seen various entities of business operations, and one commonality between all of them has been workplace stress. And as we go through our segment, we'll get back to kind of speaking to some of what that looks like, being workload, the workplace organization, resources, tools, scheduling is a proponent, the culture, leadership is big. And those are just some of the gavels. But let's hear from you, Mr. Travis Diamond, and your position about workplace stress, and give us some insight on how your services work and how'd you get here. So let's unpack some of this.
Yeah, absolutely. So first of all, I spent 6 years in the healthcare industry before I started focusing on trying to help people improve their life. And in those 6 years, I did everything from entry level registration and ER. And let me clarify, I was on the billing side of the healthcare industry, not the medical side. So I did predominantly like registrations in the ER. So that's a very stressful area, an emergency room. And then I kind of worked my way up. I got all the way up to manager, where I had about 30 to 35 people reporting to me on a daily basis. And one of the things that I struggled with the most as a leader was helping them navigate their stress. It wasn't communication. It wasn't them receiving the information I was trying to relay to them. It was helping them get through the stressors of those staffing issues, of COVID, of life in general. I mean, I think you hit it right on the head when you said everywhere, all these workplaces experience that stress. But I have a saying that stress is a universal experience. It doesn't matter what you do, who you are, where you're from, you can't avoid it. And when I realized that stress was one of the biggest reasons that people were leaving, and ultimately it played a great role in why I decided to leave the healthcare industry and pursue my career in the coaching world, because I started applying these tactics and things to help me alleviate the stress and tried to share it with my team. And then I'm like, oh, I can actually have an impact. So what I do is I sit down with people and like I let them explain to me where their stressors are coming from, what's going on, and we form a game plan and figure out how to help them alleviate those stresses, the ones that can be alleviated. Because it's important to note that, especially in healthcare, you can't just get rid of regulatory agencies that randomly show up, or you can't get rid of those annual renewal license and qualifications and things like that. You can't get rid of those unexpected downtimes when the system just stops working, so everyone's scrambling because no one knows how to use paper. Like, you can't avoid those. So when I identified that, I decided that it's been effective for myself and my team and the people I've shared it with. Why don't I just share this with other people? So that's kind of how I ended up here today.
Okay, great, great. I absolutely. So let's kind of let me dial back just a little bit.
Hmm.
We were talking about some of the factors. So if I had to organize based on my very many years of experience in the workplace and where I see the commonality of order of stressors, workload would be a leading factor. Oftentimes there's a reduction in staffing based on the business needs or the business unit and the reduction of hours. So we're getting more productivity with less, that's just business. However, following that would be leadership. And there's so many different variations of leadership styles. However, with those styles, if they don't complement the business unit and the dynamics of the team, can be a big reason. People don't leave jobs, they leave managers. And we've heard that several times. And one of my mantras, I feel that if an individual fails, if the leader has not applied tactics and effort to identify what those needs are, be it resources, tools, training sessions, support. Support is a big one. Encouragement, appreciation, those things come on board. So I would organize the stressors as they build up the pyramid, or the pyramid down per se, would be workload, leadership, then workplace conditions. The conditions within the workplace also are a proponent. I've been in business units where I've seen a total disaster of disorganization and uncleanliness and files and records from 10 years previous, and they're stepping on top of things. That's disheartening. It's uncomfortable for one. And you spend a lot of time in your workplace, and I've been in business units where the workers didn't have the resources. They bring in their own ink pens. They're bringing in their own pads. They were just glad to. They didn't have clocks, and I don't understand how the leader or business unit or manager thereof, and maybe it's just an oversight, because this is a training, it is a skill set to have those to identify those nuances and absences, right? So if you're working on a time schedule, you can't always look at a computer, especially if you're task oriented, your task is over in the middle of a department or at a workspace. You have no conception of time. And so therefore it should be displayed. I know maybe clocks are old, but they're valuable, to be able to work on a time element and a time capacity functionality. But the resources, tools, not having work surface to work on. I've been in pharmacy units that had multiple tasks taking place on one common work table. It was chaos. And that kind of led to a part of the influence on the picture selection with the wires going everywhere. And when you integrate in tasks, you compromise safety and quality. That's an additional pressure and stressor because they don't want to mess up. But remember, we're a regulated profession. We're taking care of patients. Patients are dependent on us to get the right thing, the right dose, the right way, but also at the right timing. And when you compound all of those activities in one common space and don't segregate tasks, and I'm Lean Six Sigma and Lean Sigma trained, so I have a visual conception of compartmentalizing and the value of organized workflow. And then behind that, I would say workplace culture. Culture is big, and I do know that it's uncomfortable to be in an uncomfortable workplace, where there's not a respect or regard, loud talking, and someone's trying to concentrate and or think, playing music, joking around, during serious times. And there's also negative behaviors that need to be addressed. And I think, like I said, it kind of pushes it back on the leadership to kind of keep a balance on the environment in the workplace. That can be departmental and it can be organization spread. It could be widespread. So culture of the organization, are there in things that show encouragement and motivation and appreciation, aside of the luncheons and the recognition and awards. And I know all of these things are taught and trained, but the application of those is sometimes missed. And so it's devalued. And so I don't know that those play as much value as having the general workspace. And I'll let you chime in at any time. And I think behind that, I'll wrap up with training resources and other ancillary factors. But those culture and leadership, I think, are the gavels that create stress, because those are the things that manage the workspace. Now, hear from you. Do you have any input regarding that?
Oh, I'm sorry. I didn't realize I was still, I had my mic muted. I think you are spot on, what you're saying. In my experience, the biggest complaints that I would receive from my team, and even the biggest complaints that I lodge myself as an employee, would be the workload, which directly connects to staffing issues or lack of processes in the appropriate order, and lack of actually facilitating the flow of the workload. And that boils down to leadership and culture. So there's some people or some organizations that are very big on giving the staff a voice, and some not so much. So if you find yourself in one of those organizations that they're very metric driven, which in the healthcare industry you kind of have to be, so it's hard to have that balance, which I totally understand that. But what you'll find, at least in my experience, was, hey, yeah, we can't hire anyone else when someone quits or gets fired. We don't have the man hours. We don't have the patient volume to justify that, things like that. So that would always add additional workload, have to spread out that workload across the team. And then, that boils down to leadership. Is the leader actually coming in and communicating? Like, for me, I can only speak from my experiences. So every day I would try to connect with a couple of my team members on a personal level. And the reason I would do that is because when you recognize that stress that you receive in your workload, in your work life, impacts your personal life, and the stress you have in your personal life impacts your work life, you can kind of coordinate with those people who may have had a rough go last night because their child's sick, or their finances are in disarray, or maybe they're not healthy, or maybe a loved one's not doing well. There's so many different things that, yes, work or stress in the healthcare workplace is very prevalent, but we also have to take into consideration the stress that the individual is experiencing in their personal life.
So
And
internal and external, both internal and
exactly,
external factors. Absolutely.
exactly.
Some of it's intrinsic as well.
Yeah.
Hmm.
Yeah, exactly. So there's really, you can boil stress down. So, well, I guess first let's start with, stress is designed within us to be a warning flag, like, hey, you got to make changes because this isn't good. So stress in that sense is actually a good thing. However, when you have that stress saying, "Hey, this isn't good. This isn't good," day after day, week after week, month after month, it becomes what's known as chronic stress. So that stress that you experience every day, just consistently for a long period of time, that can be a manager that doesn't know how to communicate properly. That workload is too big for you, and maybe you're just not in the right position for your goals and your passions in life, right? So there's a lot to that chronic stress. And then there's those acute stressors, which are those sudden, unexpected stressors, like maybe you see some police sirens police lights turn on behind you when you're driving down the interstate. Whether they stop you or not, your heart's going to jump up. Or maybe if you work in the healthcare setting and one of the patients is coding, or in that downtime that I mentioned, those are those acute stressors. So they will kind of compound on one another and eventually get to like a boiling point. So yes, it's very important to not just focus on resolving the workplace stresses, but also figuring out where your personal life is taking damage in the stress areas and how to alleviate those. Because when you can start working with one, you have more mental space to work with the other and help resolve it. So it's kind of like a cyclical pattern of, if you're stressed here, you're going to be stressed there. But when you figure out how to not be so stressed here, you can now have the mental space to not be so stressed at work.
Which is, I absolutely. So I see what we're having in our conversation. It's kind of both sides of the coin.
Hmm.
You know, if you have a lot of personal stress going on, and that does happen, absolutely, especially when you are parenting and you've got to get the kids. Like, so for myself, and young, early in my career, and I had 3 younger kids, and they were different ages, and I had to get the baby to one location and then the other 2 to another location, and then get to work. So if there was any hiccup in the traffic pattern, or if the baby, which he did, had a spitty or poo, as we're walking out the door, the other 2 got to be still, and you kind of got to navigate through that. So you already walk in the door like this, I'm already amped up just a little bit anyway. And we need to be able to decompress just a little bit, and that's where some opportunities of friendliness, stress friendliness, where workplaces can probably encourage this. And this is Mental Health Awareness Month. So I really wanted to bring this topic forward as a healthcare professional and kind of speak to where those are. But I absolutely identify with your area of focus, which is on the inner person and the person and their stress. And then from my perspective, as an operations manager and consultant of business units, I identify the value of having a efficient and comfortable workplace, so that the workspace doesn't add to the stressors that we already try to balance on a daily. So as my expertise is, my focus is, high level focus would be pharmacy operations, compliance, and quality. And they all go together. So if they don't have what they need, safety is compromised. If safety is compromised, that's quality. If quality is compromised, then it leads to a safety issue, So typically when I go in to do an operations assessment or a re-engineer business unit or something thereof, my high level focus, typically I work from the outside in. I work with the perimeter to see what could be those ancillary factors, that probably the low-hanging fruit, before I get into the social engineering. The social engineering can actually be manifested through the deficiencies and the deficits of reorganizing workflow, walk paths, work services, supplies, tools, training, and those things. So I typically work on the perimeter and work my way in to see what those hot points are. So we can kind of clean up the junk first and
Yeah.
then get to the social engineering, which now you're speaking to a lot there, that then interpersonally, that individual can now have some room to self-reflect or self-develop, right?
Yeah, no, exactly. So when I talk with clients and things like, and just people in general, really, that are just, hey, can you know, I'm dealing with this, can you help me out, friend, family, whatever. Almost always the stress boils down to poor communication.
Mm,
So it doesn't matter if, like, for example, I have a 1-year-old and a 5-year-old. If I'm responsible for getting the kids ready, but my wife doesn't tell me, in her mind, she's already committed to doing something else, and I've committed to doing something else. Just that no communication creates stress, because now we're ready to walk out the door, but the kids aren't ready. And I'm like, oh, I thought you were doing it. She's like, no, I thought you were. So just like if you have a new work process,
mhm.
everyone immediately hates something new in their workplace. It doesn't matter what it is. It doesn't matter how much more efficient and effective you can do your job with it.
Right.
It's stressful. So that's because it's new, it's foreign, it's something that you're ignorant to. So you automatically feel unconfident, you feel insecure about it. So you're stressed about it. And I used to be like, hey guys, here's a new process that we got to do. Here's step-by-step printouts highlighted where you click, what you do, exactly everything. You got it. You don't need to ask me how to do it. Refer to the book. And I realized that no one learns that way except me. Like, I'm one of the only people that can get click step-by-step picture instructions, and I'm good. So I would have to present the information about the new process completely different. And I watched the stress just get easy, just lighten up and lighten up. And eventually, with my teams, I got so good at delivering these new processes, or this, maybe we have a higher up coming in, so we have to do some spring cleaning, and they're coming in tomorrow, so we really got to prioritize it.
Oh,
You
which
know,
adds so much stress. Well, that adds so much stress. But our
yeah,
workplace actually should manage in its capacity, in its best every day, and not
right,
just because we're having
exactly.
guests coming over. But I get it, I understand. But to the things you're speaking to, as far as like communication style,
Hmm.
I actually, so it's funny you said. I'm glad you're spot on, because in one of my segments that I teach is R3 rules and responsibilities in leadership, and communications is one of the bullet points on the journey of leading. Understanding how people receive
Hmm.
communication, be it information on new processes or tasks, if it's discipline, if it's a up down communication coming from a corporate initiative or a metric or a business,
Hmm.
regulatory agency, something that is more significant is really going to impact them, changing schedules.
Yeah. Oh
So
yeah.
your delivery and your style and your approach need to be different, because it can, depending on the personalities. And we have all those personality tests that, would give you insight, and actually would give individuals insight on how to manage their stress. So I'm not uncertain or sure, do you integrate any of those those characteristic tests, those individual personality tests?
Yeah, so I'm a big fan. There's three in particular that I like. I
Okay.
like the DISC assessment. That's a very thorough and in-depth one. I like the strength finders from the Clifton Strength Finders organization. That's a very good one. It gives you your 34 strengths, your from your strongest to your not so strongest. And they do a great job of breaking down exactly what it means. And then another one that I really like, this one's more psychology side of it, because you got to understand yourself. It's the Big Five psychology assessment, talking about introverted, extroverted, agreeable, narcissism, and then there's another one I can't remember what it is off the top of my head. But having those three completely, I can give people exactly what they need.
Awesome.
Just yeah, especially like when you understand the psychology. So one of the things that I've learned in leadership is you have to know the psychology of your team. You have to know where they're good, where they're functional, but you also have to know the dysfunctions of the team, right? So There's a book that you and I talked about a little bit. That's what it's called. It's called The Five Dysfunctions of a Team and Five
Effective
Behaviors of a.
masculinity. Mhm.
Yeah, exactly. And that's a great book. If you're in leadership, I highly recommend reading it so you can be a better leader. And if you're not in leadership, I highly recommend you reading it so you can lead from the front by example for your team. And there's something called leading up, where you lead your boss to success because your desire to have a better work environment is so great, you will not allow your position to stop it.
Oh,
So
I have one of the books, yeah, the 360 leadership
yeah,
trainings. But I'm gonna play devil's advocate for a second on
sure.
that. Like, all of this does not lay on leadership.
No, no,
It
no, not at
doesn't.
all.
Excuse me. Because along with that, we come into our professions and our careers in workplaces for a job, to do a task. Integrating, working with people and the dynamics of changing tools, and we've never taught anyone how to be a good employee. You throw this code of conduct at them and send all of a sudden these expectations are there, and everyone's kind of walking, cattywampus, trying to make sure they color within the lines and stay within the rules of not really knowing how to really manage those. So there's some opportunity to actually probably build in those self-assessments so the team can self-develop themselves, and that goes into team building. But I think we definitely have touched on some great points of stressors in the workplace, that you can unpack this a lot. So
Sure.
this conversation in session 1, we just wanted to kind of bring it to the forefront. And then in sessions 2, we'll start to unpack all of this in a more methodical way of addressing both the intrinsic and extrinsic stressors and how to manage those. Because from my expertise, I can give insight on how to organize your work day and identify what deficiencies or challenges you may be having. And then with your skills expertise, you give them that inward insight of how to take a step back, how to breathe. I don't know what your tools are. I don't want to overspeak.
No, you're spot on. I mean, like, you have to be present, and I'm a firm believer in breath work. So, in fact, if you don't mind, I will share one thing that you can do, like, in the moment, to help almost immediately change your mental state when you're in a stressful moment. So there's two different types of breathing that you can do. One is a very slow, deep inhalation through the nose with your diaphragm, filling up your diaphragm first, then your lungs all the way up, and then exhaling slowly through the nose. And the other one is also through the nose, where you inhale fully, and then you inhale a little bit more, and then you exhale out of the mouth. Now, that one, if you do it for 5 minutes, a day, studies are showing that that's more effective at reducing stress than meditation. So I found that to be pretty interesting. But yeah, I just figured I would share those real quick.
Absolutely. And then for me, my closing on helping to manage stress in the workplace is, believe it or not, timely breaks. The 15 minutes, the 30 minute, and the 15-minute. It absolutely needs to be scheduled, organized. In so many workplaces, people work beyond their breaks, beyond their lunch. It's at the end of the day, there's no organization or assignment of discharge. The most efficient and healthy workplace that I did do assessment and do some work with, they have theirs coordinated, that it is designated, that is your time. Their computer signs off. They actually integrated IT to sign off.
That sounds like a good place to work.
I know, right? You can't work because you're signed out, and you come back and then your system is up during your time. But that keeps a little bit more organized. We don't have to worry about Travis didn't go to lunch on time, so now I'm late. Now I'm upset and I'm frustrated because I'm hungry, but I couldn't leave because there's nobody to answer the phone. So some of these created stressors can be addressed just by organizing the work.
Oh yeah.
And if we
100%.
get some of the organization done, and then, yes, absolutely, let's give them the tools for the intrinsic tools of working inward to show up differently. And I thank you very much for doing these segments with me. And next week, absolutely pull out and share up the tools in those respective order. And this is a great segment.
100%. And like I said earlier, I really appreciate you offering, extending the olive branch to me. I had a lot of fun doing this. I'm looking forward for next week as well.
Absolutely. So we want to make sure that we did have guests attend, and we want to invite you back for session 2 on next week, Wednesday at 8:30 p.m. EST. So I am going to open up to the floor. I don't know if anyone wants to speak. You can unmute. If you had any contributions or questions that you wanted to render. All right, going once and going twice. Okay, we will respect that. And thank you so much for coming on to this segment of stress in the healthcare workplace. And we look forward to seeing you on next week. Have a great evening.